How's everyone today?
Fine.
I know this. I understand this is the week before final exam week.
Oh, okay. So everyone's tired.
So,
I'm sure.
Yeah. So.
And the last thing they want to do.
all of the students have, either major projects to do,
yes,
or,
very
or
tired.
final exams, or so. Thank you for being here bright and early this morning, and I'm very pleased, to welcome our guest to the Breakfast with the Expert this morning, Miss Rebekah English. Rebekah is currently serving as the Assistant Director for the Tennessee Department of Health Northeast region, which covers a large number of counties in the Northeast region of the state. And she assumed this position after serving as the County Director for Greene County. So she is a resident of Greenville. Rebekah also serves on our department professional advisory committee and is helping us through curriculum revisions and updates, and we really appreciate her service in this role. She holds a bachelor's degree in nursing and an MPH from our college. So she also happens to be an alumni of the college and graduated, I guess, with her MPH back in 2002. And she's really been on the fast track, since then, assuming leadership positions within the Department of Health and expanding, her roles and responsibilities. Today, she will be presenting about 3 major developments in the public health field. Accreditation of public health departments, quality improvement efforts, and certification of public health professionals. Many of you have heard about those developments and learned about them in class. So today you will get to hear the perspective of the practicing professional, which I hope will be better than the perspective of your course instructor, i.e. myself. Today is our fourth Breakfast with the Expert for this season. This concludes our Breakfast with the Expert for this season. So thank you for helping us celebrate the conclusion of 5 consecutive seasons of the Breakfast with the Expert program. We look forward to your presentation, and thank you for being here today.
Thank you. Thank you. Good morning. Good morning. I know as I just heard that it's the week before finals, so I know you're tired, and I'm wondering if can we dim these lights just a little bit, just to maybe, I don't know if that's possible. Yeah, I think that's better. Well, thank you for having me with you today to share with you some just work experiences and different things as we go through these subjects. First thing we're going to start out with is accreditation, Department of Health. And the National Accreditation Program. Of course, the goal of the National Public Health Department accreditation is to improve and protect the public's health by advancing the quality and performance of public health departments. Our goal in our region over the past few months has been completing a community health assessment, and we have been helping our local hospitals and our local communities complete that. But what that is to develop strategies to address the community's health needs and identify their issues. So we have done that in every county in the Northeast region by the help of our health educators that are located in our health departments and our county directors. That has been a big project for us. We have been able to partner with our communities even more, and also our local hospitals. Bruce Behringer, he started our community health assessments with us last year, and we have come to the finish with that and helped our hospitals complete their projects. A community health assessment, as far as accreditation, is a prerequisite required to apply to the Public Health Accreditation Board. It is voluntary to be accredited, and you start with community health assessment. So we're well on our way, and it looks like we are moving toward in that direction with our county health departments. Public Health Department accreditation is defined as the development of a set standards, a process to measure health department performance against those standards, and reward or recognition for those health departments who meet the standards. We are actually engaging our community in the process. We're looking at our local partners, our stakeholders, and we're helping them through this process as we've completed it. You know, you ask yourself, what's the benefits of going through accreditation with the health department, Department of Health? What's the benefits of that? There's several. You know, it looks to us as we're high performance. We're in quality improvement. We're highlighting our strengths, and we are looking to improve on what we need to achieve as our goals. It recognizes us. It validates our public health departments, and we are accountable, and that's important. We are accountable for what we do. We would have improved communication and collaboration, and also with accreditation comes the possibility of increased access to resources, grant funding. When you look at accreditation, there are 12 domains in the Public Health Accreditation Board standards, and I'm going to go through the domains and pinpoint for you just on what we do on an everyday basis that would actually pretty much just focus in on those. The domain 1, assess. Standard 2.1, participate in or conduct a collaborative process resulting in a comprehensive community health assessment. We've done that. We have done that. We have completed that. We are on our way. Investigate, domain 2. Standard 2.2, conduct timely investigations of health problems and environmental public health hazards. I've listed for you our communicable and environmental diseases and emergency preparedness, works to discover and eliminate the threat of communicable diseases and to educate people how to protect themselves from illnesses. We also conduct surveillance activities in order to monitor new emerging infections or identify clusters of cases that could be related. Investigations are conducted to pinpoint the source of disease and to prevent dangerous outbreaks. What we're doing right now as the Northeast region and across the state of Tennessee, Dr. Dreisner, our Commissioner of Health, wants our public health department employees, our Department of Health employees, to respond in the event of an emergency preparedness. If we would happen to need to open up our regional health operations center, he wants a 90% callback or confirmation to an alert within 1 hour. We are conducting those exercises across the state at this point. As of right now, Northeast region, we are calling back within 95% of our employees are calling back within the first 30 minutes that we are mobilizing. That tells us that they've seen the alert from the Tennessee Health Alert Network. They've seen the alert from us. They've confirmed the alert, and they're able to respond. So we're already practicing that. So we do this on a continuous basis. Inform and educate, domain 3. Inform and educate about public health issues. We have a health educator in all of our county health departments. Our health educators are liaisons for our county health department directors. They are vital to our educating our community on health issues. They partner with our local school systems and our partnering organizations. They are a very important aspect in the route if we would go toward the route of accreditation with our public health departments. Community engagement, domain 4. engage the community to identify and address health problems. We have our county health councils. We have health councils in every health department. Has anyone heard about county health councils? I just need to know. Yes? Yes. Our health councils, let me explain what those are. Our health councils are in each community. They're made up of stakeholders in our community that care about the health and to improve our health in each community. So our health councils play a vital role in what our community plans in improving our health. Members of the community, they improve those community health outcomes. We are forming lasting partnerships to promote a change. And the last initiative is Primary Prevention Initiative, as far as what we've most recently put together in our communities. And this is from Dr. Dreisner, our Commissioner of Health. It's not just our health educators or county directors or nurse supervisors that are in the communities making a difference. We've actually put together a health department team of employees that we're doing initiatives and making a difference in our community. I'll give you an example of real life what's going on in Johnson County. The county government is actually helping to fund this. They're putting a garden beside the health department, and they're planting fresh vegetables. And when our patients come through our WIC program, they're actually going to be able to pick a vegetable, and then they'll learn how to cook it. Because a lot of our patients sometimes do not know how to cook or prepare a fresh vegetable. So that's important. It's important to teach them how to do those things. It's important they know that they can grow their own food and live a more healthy lifestyle. Policies and plans, Domain 5. Develop public health policies and plans. We have our local emergency planning committee in every county where we work with our emergency management agencies. We have health department staff that are on those committees. In the need of an emergency, the health department is right there. We're there when we're needed. Participation in health department strategic planning. We've recently gone through a strategic plan across the state of Tennessee. And our employees in our health departments were actually a part of that strategic plan. They actually were asked about what they felt like was important in how they can make a difference in their communities. And of course, the community needs assessment. And I keep going back to that, but that's been a big project of ours. Public health laws, Domain 6. Enforce public health laws. Most recent, in 2007, we enacted the Non-Smokers Protection Act that came from the Department of Health, where smoking is illegal in all enclosed public places within the state of Tennessee, with a few exceptions. And then, of course, effective April the 1st, 2013, prescribers will be required to look up their patients in the state's Controlled Substance Monitoring Database before beginning a new treatment with an opioid or a benzodiazepine, and at least yearly thereafter if treatment continues. We have a huge issue in the state of Tennessee, and more so in northeast region of Tennessee, where we have the abuse of drugs and controlled substances that are legally prescribed by our doctors. We are having more and more babies born dependent on these drugs, and it's an issue. So Dr. Dreisner and our Department of Health pushed for this controlled substance monitoring database. One statistic in 2011, a total of 1,062 people died of drug overdoses in Tennessee. That's a lot of individuals, and it's important that our medical community know the importance of when we prescribe these controlled substances, that it's important to have that patient and doctor conversations. Access to care, Domain 7, promote strategies to improve access to healthcare services. We have community partnerships, but of course the local health departments are a lot of access to care, especially for our uninsured individuals. We have primary care clinics in 4 of our 7 counties in the Northeast region that help our community with access to care. Workforce, Domain 8, maintain a competent public health workforce. I've got LifePath on this slide, and I'm looking at Paula Masters right now and Kristen Minnick, and I'm probably not recognizing some of the other LifePath individuals in here. However, I want to thank the program and LifePath providing an academic and non-academic training opportunities for our public health workforce. It's been very beneficial and continues to be, and I want to say thank you. When we look at that, we also think about internal succession training for our workforce. That's what you're here today for. You're learning the world of public health. We need a competent workforce coming our way, and so I'm so glad to see many faces in this room today. Quality improvement, Domain 9. We evaluate and continuously improve processes, programs, and interventions. And I've put in here lean, implementing lean process, and lean implementation is focused on getting the right thing to the right place at the right time and at the right quantity to achieve a perfect workflow. So we're looking at our processes on a daily basis. I can give you one example of a lean project we're doing right now in our health departments. Through quality improvement, we found across our region we were having issues with lab controls for some of our lab equipment in our health departments, that we were making multiple mistakes, and it was a quality improvement issue. It was one of our standards we needed to meet, and we were making errors. So what we did, we put the lean process to work, and we now have our quality lab controls on a database, and that database will not let you make a mistake. And it's been more efficient for our nurses, more efficient for our quality improvement coordinator. Evidence-based practices, Domain 10, contribute to and apply the evidence base of public health. Promote understanding and use of research results, evaluations, and evidence-based practices with appropriate audiences. We continue to do this. Quality improvement projects, we use the plan, the do, the study, the act cycle. We look at that whole picture, and we do that on a continuous basis. Administration and management, Domain 11, maintain administrative and management capacity. We do this with open communication and a team approach. I'm all about team approach. When we make a change, or we're looking to make a change in our public health departments, we always put together a team of individuals, whether it is at our administrative level all the way down to our front lines. It's a team approach, and that's what we do on an everyday basis. When we look at administration and management, from my perspective, I always ask myself 2 questions. When we're going to make a change, or we're looking to make a change in our public health departments in this region, I ask 2 questions. 1, How is it going to affect the service we give to our patients and our community? And number 2, how is it going to affect my employees on an everyday basis? Those are those 2 questions I always ask myself. And if it does not benefit our patients or our employees, we do not make a change. Governance, Domain 12, maintain capacity to engage the public health governing entity, Board of Health. Is anyone familiar about boards of health in our community? Good, I'm going to explain that. We have boards of health in every community in the Northeast region, and it is in the Tennessee Codes annotated. But the Board of Health is made up of your county mayor, your director of schools. We have 2 physicians on each Board of Health in our counties, 1 dentist, 1 pharmacist, and 1 registered nurse. The health department director and the health officer in that community are ex officio members. And we also, it's optional to have a veterinarian on our boards of health. These boards of health play important roles in our community. One, we meet once a year. They look at our staffing, they look at the programs we've initiated, they get a good overall what's gone on in the last year. And then they also approve our annual budget, and they also help enforce rules by the commissioner, Commissioner Dreisner, in the control of preventable diseases. So I wanted to mention that we do play, governance plays a big role in our health departments. Baldrige, National Performance Excellence Program, the Tennessee Department of Health's journey. At this point in time in the Northeast region, we will be having a health department apply for Level 1 Baldrige, and that will be Carter County Health Department over the next year. We will be applying. We're already in this process. The task at hand and the departmental challenge is to use one framework through which multiple challenges and refreshes can be organized to maximize value of change. So that's our challenge. And our Commissioner's challenge has been pursue organization-wide performance improvement through the Baldrige Performance Excellence Program. Dr. Dreisner introduced this to us probably a year and a half ago, and now we're going forward with that change. This is an improvement for us. It's an improvement in our processes and how we look at what we do on an everyday basis and how we can improve. This is the Baldrige Criteria for Performance Excellence Framework. It's a systems perspective. You can look at, you're going to see your organizational profile, what your environment is, your relationships and strategic situation. You start with your leadership. You go to your strategic planning. You come down to customer focus. Then you go to the measurement, analysis, and knowledge management, workforce focus, operations focus, and the results. Has anyone seen what I call the burger of Baldrige? Has anyone seen this? Oh, good. Thank you. So we're going to go through these, and what we're doing in actuality right now in each of these topic areas. It's hard to see. This is what we're doing. The organizational profiles. Organizational profiles have been collected and reviewed and summarized for 14 sections of the Tennessee Department of Health. That was completed in March 2012. And it addresses the environment, relationships, and strategic situation. We've already completed that part as a state with the Department of Health. When we apply individually with the Carter County Health Department, we'll look at that individually with us. Leadership. new organizational chart and effective meetings process and participatory decision-making processes. We want to hear from our employees. That's basically what that says. We want to hear about what's happening in our processes. Regular telemeetings among regional staff and with central office. We're having multiple teleconferences to keep us up to date on information from our central office in Nashville. And leadership book review series, a book club. So we're actually going through management improvement processes in some of the books we're reviewing and reading on a monthly basis for leadership. Strategic planning. Health Department participation in strategic planning process. We've talked about that a little earlier, that we actually were involved in the strategic planning process, and our employees, all of our employees participated in that. A complete top to bottom review for the state. That's being completed on an ongoing basis. Customer service, community-based community health assessments. I keep bringing that up, but it has been a big project of ours. Customer-focused government training. That's a training that's going to happen across the whole state of Tennessee with all state employees, not just with the Department of Health. We are the face of Tennessee, and how can we best serve our community? So we will be applying that training for our region. There's 3 employees that are train our employees, and I'm one of those as far as going across our region, just for us to do better customer focused. And annual patient satisfaction surveys. We do those yearlies to make sure that our patients are receiving the care that they need, and are they happy with our services. Measurement, analysis, knowledge, and knowledge management. Improved information systems with our record keeping, vital records. The Northeast region and the Sullivan County Health Department will be piloting for the State of Tennessee Department of Health the electronic medical record. That will be put in place over the next year. And our county health department assessments and audits. Every health department over the last year, we have assessed different areas of how we're providing care and focusing on quality improvement. Our workforce focus, life path public health competencies, survey and training. I mentioned that again. Our state human resources changes. We had Team ACT and our SMART formula performance evaluations. And what Team ACT was, it was an overhaul of our performance evaluations. And our SMART formula, as far as our evaluations, made them more objective. They were not subjective job plans anymore. Our employees know what those expectations are and know that they know what they need to do to meet those goals. They are no longer employee workforce surveys. We recently put in place an employee workforce survey. I've been with the Department of Health for 16 years. And in our region, we had not put in place a survey for our workforce. So we began that in December. We collected the results, and we have presented that back to all of our employees in the Northeast region. And we want their feedback on how we can improve. That's important to me. That's important to our regional director, Mr. Adams. It's important for us to know how we can help our employees do their job more efficiently and effectively. And employee wellness activities. I think you'll hear in the next couple of months the governor will be announcing his wellness initiative. And the Department of Health employees have already started down that track of employee wellness. So we're maintaining that. Operations focus, quality improvement projects. I had mentioned a while back about our lab controls and beginning the lean process with that. Review grants philosophy, competition and evaluation, and also county health department assessments. We are assessing our health departments on a quarterly basis to make sure that we're meeting our goals. And the results. Assistance to encourage parts of the Tennessee Department of Health in the Baldrige process, and data collection for the public health accreditation, and also document improvements in health indicators. We're beginning the process, but accreditation, performance, we're already on that track. So, the Baldrige application premises, everything relates to our mission. We always go back to our mission with the Department of Health. And of course, our mission is to protect, to promote, and improve the health and prosperity of people in Tennessee. It provides us a framework for making organizational performance improvements. We always look to our mission and what we're doing. You can see I've put on here, this is in all of our health departments in multiple places for our employees and also for our customers. For them to see what our goals are. We want to achieve our unique competencies through community efforts in primary prevention initiatives. I've talked about that, where we're more outreaching in our communities and doing different things with partners and our stakeholders and collaborating. And we're to promote effective and efficient government through people-centered performance and improvement. We are passionate people innovating. And this has been it's one of our goals. So we go on to certification. Certification of public health professionals. Certification, what the knowledge you're going to need to be certified as a public health professional is biostatistics, environmental health science, epidemiology, health policy management, and social and behavioral sciences. And I'm sure this is not foreign or anything to you at this point in time. What are the benefits of credentialing? This is things that I have looked at, and I've listed what I feel are the most important parts of credentialing, and I've put our source down there. But the commitment to the career of public health. You know, when you want to go make that step further and be credentialed as a public health professional, you're making that overall commitment to public health. It's in your heart. It's what you do, and you're committed and dedicated. You're staying current in public health. We all need to be current in what we do. We all need to be making sure that we're updated on the most everyday issues in what we do on an everyday basis. Increased recognition as a public health professional. It will recognize you. It will set you apart from everyone else. Improve the competency of our public health workforce. When I look at that, and as from an administrator's point of view, and I look around at our workforce, and when I know in the next few years, 50% of our Tennessee Department of Health workforce can retire, I want to make sure that the employees and you all coming into the world of public health are competent in what you're doing. We are a team. And when you have that big of a increase in retirement capable individuals, they are taking a lot of knowledge with them when they leave our department. And it's important that our workforce that is still with us and our workforce that is coming on board are competent in what they're doing. Ensuring high standards in our workforce. I think that speaks for itself. We want to make sure our standards are high. We have high expectations. Raise the visibility of public health. You know, we need to promote ourselves more. We really do. Out in the world, we need to promote ourselves more. When you serve our communities, sometimes they call on public health when there's an emergency or something's going bad. But we need to promote ourselves on what we do good all the time, because we are doing great things all the time in the world of public health. Distinguish yourself from others, and it does distinguish yourself from other individuals in the workforce. So the certified public health professionals must earn 50 CPH recertification credits every 2 years, starting with the first year of being credentialed is awarded. And this is an extraordinary commitment to the public health profession to continually stay current in the world of public health. I think this is a great thing. I think it's great for our public health professionals to be certified. Questions? I've put on there my address and my email. So do we have any questions?
So does everybody have to be certified?
No, it's voluntary.
What is the percentage of that right now?
You know, I am not sure. I know it's voluntary.
It's very small.
It's very tiny. I was looking at the CDC website a couple of weeks ago, and it's not a high percentage, but I wanted to see as far as their employees with CDC. And there were quite a few that are going through the process on a yearly basis. I'm sure it's not easy to be credentialed.
Do you have to pay for those?
Yes,
Okay.
yes, yes.
Also, what are you doing for the employee wellness activities? What are those?
Employee wellness activities. What we're doing is, it's across the state with our Department of Health, and what we're doing is in every health department, we're promoting fitness activities. Most of our health departments 6 months ago did not have a fitness area within the health department for our employees to work out during their breaks or lunch hour or right after work or even before work. 5 of our county health departments have a fitness room where our employees can go. We're doing a lot of lunch and learns with our employees as far as eating healthier. And during those lunch and learns, they're also exercising the last half of their lunch hour. So they bring a bag lunch. They talk to a dietitian that we already have in-house. So it's easy just to say, hey, can you do a lunch and learn for us? And then they're doing exercises together. Many of our health departments have teams in the health departments where they're exercising on their lunch hour. I have a small county in the Northeast region. I'm also the health department director for Unicoi County. So when I'm there, and I'm only there 1 to 2 days a week, but we have health coaches in every health department that we have. They're employees, and they've volunteered to be health coaches. And in my county, we have great sidewalks that we can walk on pretty weather. I've even seen them out with their umbrellas as well. But they walk. It's almost like a competition, really. So they do some competing as far as who's getting healthier the fastest, I guess. But all of our health departments have teams that are doing employee wellness. We also have a couple of our health departments, Carter County and Johnson, and even Unicoi, are doing wellness newsletters monthly for their employees, looking at what's going on that month in October, breast cancer awareness, looking at those awareness months and really telling our employees, it's not just about being healthy, but, make sure if it's time for your mammogram, get your mammogram. So we're looking at that, and we're doing that in all of our health departments. Right now across the whole region, we're doing a health initiative where we're putting in how many ounces of water we drink a day. Are we doing exercise during our lunch hour? Are we eating our fruits and vegetables? We're plugging all that in. So it's a competition across the state at this point in time. So we're right there. And we also, Rosalind, I know I'm talking a little bit more to answer your question, but there's so much going on. Rosalind Carita, our wellness director for the state of Tennessee, actually we are pinpointing our health champions in every health department, just a lot like what our health coaches are that are already in place, but they're our health champions. They're going to cheer us on.
So you're going up for Baldrige on the regional application level, Rebekah, or the state application level?
Regional.
On the regional. And you may not be able to tell me this yet just because it's on down the pike, but when it comes to accreditation, will it be the same? Will it be on regional level, or will you go for state application?
I don't know. I can't answer that. I'm going to be honest with you, Paula. Carter County is our first county health department in our region to go for the level 1 application with Baldrige. We had thought we would do it as a whole region. Do the level 1 application for the whole region because we feel like it's going to improve our processes. It's going to help us. So we wanted to do it on a regional basis. However, we decided just to go with one single county health department at this time as far as level 1. And next year we may look at the whole region as a whole. So I'm not sure as far as accreditation as what we'll do. Yes.
Morning.
Morning.
Just for example, could you give us some tips on, we're talking about Baldrige and the processes, the initiatives that you have in place for the regional health departments. Could you talk to us about what we can do as public health students to get involved, to like I live in Carter County. I've lived there for 30-some years and volunteered years ago with CASA program. So is there something that we can do collectively to help and volunteer at our health departments to push the initiative forward?
Well, I think you can. As far as when we look at Baldrige and we look at our communities and community involvements, I had talked about our health councils in each community where we have members that are part of the community, they're stakeholders, they're partnering organizations, they're individuals. I think that's one way as far as helping with the health council. As we go through this process, engaging the community is going to be, it's going to be part of it. And from a team approach, we want to pull in, as yourself, as a student in public health, to give us insight on how we go forward and how we can improve things, not only inside our structure, but outside in our community. So I think there is specifically a way you can do that.
Rebekah, thank
Yes.
you for a great
You're
presentation. My question is about the community health assessment, which you mentioned several times.
Yeah, I did.
And it appears that you've invested lots of time and effort.
Well, now I don't know if it's been myself or our health educators have invested a lot of time. I look in the audience, but it's our employees that have invested a lot of time, and our health department directors and different things, they've invested a lot of time with this. But go ahead.
So my question first, was it done for each county in the region?
Yes.
Okay, so it's at the county level, not at the regional level. And where can we find, the results of those assessments? How can we access them?
Those have been completed. I'm not sure if it's going to be on our Department of Health website, but those assessments have been done. Some of them have been intertwined in the hospitals' community health assessments. And when you look at Mountain States Health Alliance, I was looking at their community health assessment the other day, and we're listed as a partner. So some of those community health assessments are actually listed with like Mountain States Health Alliance and with the hospitals as well. As far as our own, the ones we have completed with the health departments, that's a good question. And I can take that back and we can see where those are going to be submitted and if they're going to be available online.
And I guess in the meantime, if if a student or a faculty member or someone else is interested perhaps in reviewing the findings or in using them for a grant application,
it can be shared. Yes,
directly?
and I can direct you in the right direction.
Okay.
Yes.
Okay, great.
Yeah.
And then my other question, I guess, which is a little tougher, I recognize, is about certification.
Yes.
This is a relatively new national initiative, and as you know, there's been lots of national debate about, I guess, about the value and perhaps more so about the barriers, mainly financial-wise and time-wise, of pursuing certification. And I just wanted to know, I guess, if the how the Department of Health feels about this, or how have they approached this debate?
I have not heard a lot of information about the certification and how they are approaching this. I have not heard that. What I presented to you is how I felt that it could distinguish a person apart being certified. And I agree with you. The barrier as far as applying and going through and completing the credentialing process. And also, when you look at the credit hours that you need to complete every 2 years, that's also going to be a barrier as well, because you need to keep your credentials. And if you're committed to credentialing, going through the credentialing process, you're going to want to stay credentialed at that point in time. The Department of Health, from my knowledge, I have not heard a lot of information on the credentialing process. I can tell you, in hiring and looking at the workforce in the future, it is not on our specifications for an administrative type position like a county director to have that credentialing in place. It is not a part of the specifications at this point in time. I can tell you that.
Thank you.
You're welcome.
Other questions, comments? Okay.
Thank you.
Very much, Rebekah.
Thank you.